What's up, everybody? Welcome in Body Movement Podcast. I think we're on episode 15. At some point, I'm going to stop saying the numbers because we're just getting up there too fast. So I can't count past 15, even though I have a history of a numbers guy. Welcome into the right. Welcome into the Body Movement Podcast, episode 15. Dr. Allison Sinikowski, younger sister. I'm Matt Sinikowski, your host. And then today we are here to talk about back pain, the number one disability. I asked you in the country and you told me the world. And we want to talk about myths around back pain because this is something we've been passionate about in our early episodes, is breaking down myths, misconceptions, and then how that leads to people becoming customers, recurring customers in the healthcare field, in the healthcare system, just in the cycle of treatments and pills and therapies that never kind of get anywhere. And so you're going to walk us through 5 of the myths. I'm sure there's many more than that, but these are probably common ones that you hear in your practice and over, the decade plus you've been doing this. And unlike many injuries, which happen to you, sprain your ankle, you break a bone, there's a very clear diagnosis of what happened, why that caused it, and then a treatment plan to kind of correct those issues and get you feeling better. Where back pain is this complicated thing. And I'm sure there's even mental components to it, but there's also these multifaceted things with how your entire body is working together, and a lot of preconceived notions that are just kind of incorrect. So I think we want to level set the field, being we are the movement podcast. We're talking physical therapy and pain. This is the number one problem with pain in the world. I think this is a good episode for us to start getting our message out of framing everyone's mind differently about how they think about these things. And if they're thinking about them the right way, then they can have better discussions with their healthcare providers once they kind of get into the system and they're experiencing this stuff.
Yeah. So a common theme we've heard in previous guests in different disciplines is that, anytime you're dealing with people, it's multifactorial. People have emotions. People have so many other things that affect them, whether it's emotionally, spiritually, physically, environmentally. There's so many layers to people. So like you were saying, if somebody has an ankle sprain, we know roughly the roadmap, right? It doesn't mean that roadmap isn't slightly different for everybody. It doesn't mean whatever, but we know
your framework is tighter.
Your framework is, you still have to treat that person as an individual, but you have to protect the tissue that was damaged. That you have to restore certain things at the ankle. You have to reinsert that back and get hip strength. So
right.
With something that's an acute injury, the chances that it's the roadmap is around is high.
Yeah.
Okay. The difference with low back pain, more so, that is not acute in nature. And acute in nature means it happened abruptly. There was a clear start point, and we know how to manage it from there. Yeah. So I was tweeting yesterday some things back and forth, and one of them was talking about this and saying we shouldn't even have to give low back pain a diagnosis. In the insurance world, you have to pick what's called an ICD-10 code and say it is a disc issue. It is a stress fracture of the back. And it kind of forces healthcare providers to pick something. And really what the research is showing is that there is this whole plethora of low back pain that is just low back pain without a structural cause.
Yeah.
And there's 2 camps to that. And we could get experts that I also follow saying the other side of that.
Yeah.
If yours is do you need the nitty gritty? Do you not? And really the movement that I feel most strong in is that for some people, you don't need to find that spot. And we'll talk about that, but you need to treat this person. Low back pain, just if you Google it, it's exceeding $100 billion per year with regards to healthcare costs in just the United States.
Jesus Christ.
Jesus, right? So it's and what boggles me more is not that, that's fine, but there is strong research and recommendations. I mean, that's the world we're living in right now, right? We follow recommendations from abiding bodies. And here this recommendation, the Lancet is a journal that's worldwide with various medical things. So there's musculoskeletal, there's things, cancer, whatever. So it's a world-renowned journal. In 2018, I think it came out with a series of updates and recommendations for treating low back pain. And then just last year, it was looked at to see, like, has anything changed? And it hasn't. It's still going the wrong direction, where people are still having more back pain. So we have all this information. We know all these things. There's huge abiding bodies asking people to change. But the problem is, those, in my opinion / what I see, is that those changes aren't happening. One, because healthcare providers don't have time. And two, because that it's almost always less money spent from the healthcare dollars.
Right.
So we'll get into some of the myths and touch back on that. But a lot of the change isn't happening because people aren't educating themselves, or the vested interests are too deep.
Yeah.
And the combination of those is quite scary.
Yeah. Right. And there's also a problem with how the institutions are so big, and to implement change takes so much time to put in new practices. I coming from corporate America, you just, like, any new idea that sometimes came into organizations I worked from, you had to just gather all these people to get on board to make one little change that wasn't even that important.
Yeah.
And so you think about an institution where it's nationwide and there's different practices, and how fast can you get that information out and implement it? And then there's all these guidelines with the insurance companies that if they don't get on board, then it doesn't even matter if they're not going to reimburse for certain things. So that's a problem in itself. So again, what we're trying to do with this podcast is just educate the public, built on developing yourself, learn this stuff so that you're the most educated going into that system, and you can have a better dialogue and understand
Absolutely.
how these problems work. And like you said, back pain, I think, while it can have an acute aspect to some of the injuries, I think people that have probably misdiagnosed themselves, like not noticing that they were setting themselves up for that acute event. So
Right.
they confuse it as a acute event. Like, I never had back pain in my life, and I did this one thing, and now my back hurts. So it was that event where it's actually been, you were just sitting there, your back was just waiting for that moment. And
right. So if you think
yeah.
about, go ahead.
Go ahead.
If you think, I always describe to people, like, when we talk about, I think it's Levinson's quote, but we always say the hurt that you feel from an injury can certainly become the feeling that you hurt. So it progresses from being a tissue issue, to then being more of a fear avoidance, a slight psychological aspect to it. What your friends say, what your family says, what your medical providers are telling you, what image you had that showed something that 80% of the population has anyway. Now you're defining yourself under these things. So there's a couple of things that I love. So one analogy, just try to help people understand with, like, anything. Let's say low back pain. You hurt your low back. If you get a cut on your arm, it heals, right? Like, physiologically, it heals, even if you don't touch it. Like, actually, if you stop picking the scab, it heals faster. But it heals. Like, that is the way we are made. So when we keep saying that, this has got to be an issue of something is pathological or not hurt or this and that, that's not the case, because things heal. Disc herniations heal. Fractures heal. Do they need to be put in an environment to do that? Sure. Yes. And are there some things that maybe on image won't heal? Yes. But if you are treating somebody that has that non-acute kind of chronicity to something, chances of something being pathologically damaged is so low. And anything, I mean, like 1%. And like, and same with regards to anything that's sinister, cancer, this, things that we worry so much about when you feel back pain. There's a host of people maybe listening to this, but will say that, if I feel back pain, my first worry is I have cancer. Like that is a true fear in people.
Right.
And that's where a medical provider almost feels that they have to order image to cover their ass, rather than, no, if this is this, it wouldn't do that. And use your clinical brain that you went to school to develop and continue to develop to decipher if this is a red flag situation or not.
Yeah. There's a combination of fear from the healthcare provider to cover their ass.
Oh God, yeah.
Right. And then, but there's also the fear then on the patient side, forget the cancer stuff, even from a movement side of, once they start feeling even a little bit better, they're scared to go back doing what they're doing the way they did it. And then they start overcompensating in ways that they shouldn't be, because they're trying to not do that. And that's the worst thing you can do, So there's like this, again, we keep talking, there's this parallel streets of doing things wrong on our end because we're not educated or we're scared. And so that's what we're trying to do, educate a little bit. And then there's this side that they're scared to not to miss something, and therefore do too much investigating where it doesn't need to be done. And that's planting the wrong mindset in the people, because they're worried about things that are probably not even a factor in their situation.
Right.
So, and again, back pain is so complicated because it could be due to different parts of your structural body and the way you've been doing activities your whole life. So I think it's that's a good
or not
or not doing
not structural.
Right.
Yeah. So I use Tiger Woods as an example sometimes, because obviously he's had so many back injuries, and I don't know, I'm not in his circle, I don't know anything, but I sit back and wonder what's going on, what advice is he getting, right? He has access to care, so he can get whatever he wants or needs. His back wasn't an issue until his world fell apart. And once his world fell apart and all of this stuff happened where he wasn't this golden child anymore, his back started hurting. That is in the research that is out with regards to the factors behind low back pain, there is no question that played a role in this. And all of these documentaries are coming out about him saying all this stuff about, how differently he's wired, right? Like a different, and like a prodigy, and into all this different stuff beyond golf and all that. And there's no doubt he's the one with the most back pain in my mind, because the psychological component and the other aspects of his life, in my opinion, from a wicked outsider, media driven, inside out kind of thing, it's not surprising to me.
I think about you all the time with Tiger, just because I would love if you were in the room, during some of those meetings, because you've talked about on prior podcasts, people that have money often just go for those experts that can just get in there and pass and do some passive treatment or surgery, and then okay, you're good. And now you look at somebody like Tiger, and he's like, now I have to wake up at 3 a.m. and stretch for 4 hours just to get ready for a tournament where I'll be out there for 4 hours. I don't even know. Right.
What's that?
I don't even know if that's the way to do that. But when you compound issues on issues and you hear something, you're like that, and you're like, God, even it's almost like the money and the access to the people is detrimental in a way. But again, we can't speculate because we're not in those circles, but it all those signs are there from the myths that we're going to be talking about,
Yep. So I look at that. I have I was reading an article this morning that is entitled "Sticks and Stones," and it's the impact of language in musculoskeletal rehab. It's a great article.
We did a whole episode on nocebos.
Yeah. Right. So this guy, so he said, and I was like, yeah, this makes sense. And you and I have talked about this in various ways. The quote is, when we are physically and emotionally low, we not only hurt more easily, we also seek information that supports our vulnerabilities. So healthcare professionals need a keen sensitivity to the ways in which patients hear their words and how those words might be misinterpreted. So if somebody's low and hurting and, low back pain, Aaron had low back pain, a pretty acute episode last year.
Yeah.
And, sensitive to me, I'm like giggling at him a little bit. I'm like, you're going to be okay. He's my husband. So I'm like, you're going to be fine. But we talked about it after. I'm like, he's like, if I didn't know you, I don't know what I would have been. I still probably would be down.
Right.
Because
right.
he would be a perfect example. That would have been MRI, this and that. And it took 10 days of relatively nasty pain
Right.
through that.
Yeah. And Howard Stern famously went through a rough patch with back pain, and he went to a doctor that I'm not going to remember his name, but he had back pain for many years, and he just found out that it didn't get better until it was psychologically driven. He was laying on the floor in between segments on his radio show. You couldn't sit or stand right. He was just like at this low point, and this doctor almost didn't do anything physically with him and just got him to a better place mentally. And it was when he was going through after his divorce and all this stuff. So it's just crazy that you just keep hearing more stories like that, but yet there's still this non-implementation of the research that is out there. And the doctor's name was John Sarno, who passed away, that fixed him. But I don't even know if he's a renowned back specialist, but he was highly criticized by people in the back pain world because so much of his stuff he was like, the medical system sucks at treating it. And he was just treating people as a psychologist, and he wasn't one, so much was mental pain. So I'm curious to see how these myths that we're going to talk about now kind of get into stuff like that with some of these high profile ones like Tiger and Howard and areas like that probably relate to a lot of people, and hopefully we'll get them thinking differently if they're in situations like that today.
Yeah. And I think, we do, there's an interesting word called that is in that same article is associated. It's called therapeutic emplotment. So when you're with a patient, you got to give them what the landscape of the care looks like. You can't say, I'm going to do this and you're going to be better. You can't, especially with low back pain.
We talked about that in nocebos. When you promise an outcome and they don't get to that outcome, then they think something's even more
so demotivating, right? You get a surgery, it's supposed to be gone, and you still hurt. You do this, you do that. So if you, and again, your words as you're planting this story for them are very important. Where you walk into the room, like, okay, this is the bar. Sometimes I go over to the gym across, next door. That's where we will do squats and deadlifts and lunging. And, we will do a lot of this stuff there.
Right.
And you have to take your time and all of that. So that's another episode. But just, as a listener, I think a lot of times when we have these conversations out loud, people are like, oh, back pain is not all psychological. No, it's not. It's multifactorial, and psychological can be a part. Psychological is a part in that. How are you being motivated? How are you discussing it? What are you saying? But you don't, no, it's not all psychological. No, we're not saying that.
Yeah. And so I think, and people get defensive with that a lot, right? Because you're telling them that the problem's in their head. And we're saying a portion of it could be. And if it's not getting better, it could be that one, you're on the wrong path of what you're physiologically doing. And then two, that gets bundled with the fact you're not getting results that then weighs on you. So it's like, it could be the chicken or the egg, but it could be in either direction depending on your situation. And because it's multifactorial, multidimensional, and there's no one certain cause, and it's all customizable to somebody on why they got there, that's why the defense mechanisms go up. And it's just that part of it never gets discussed.
Right.
And if it does, it's still not well implemented or known or applied to people in the practices.
Right. And then healthcare providers need to stop feeding that.
Right.
So,
That's
so
100.
somebody
Yes.
comes to me and we're going through something, and then they have a personal trainer and we're communicating, we're doing a great job. I just had somebody yesterday and I was like, dude, you need to rest. And he didn't want to hear it. And kind of like what Fred talked about, like, I'll tell you my opinion. And
Yeah.
then, but it's like, well, I'm going to be getting an MRI on I'm going to get an MRI on my back next week. And I'm like, okay. So then if the MRI shows something,
Mm-hmm.
are you going to rest? Like if you need the MRI to rest, cool, like go for it. But
Yeah.
or
Yeah.
so like to me, like that communication, and I will talk to the doc. I know the doctor he's going to see, and I'll tell him, and I won't. That doesn't mean he won't order an MRI,
Right.
but I almost want him to, because I almost want him to find something to make this human being rest that will
Yeah.
not rest.
And it's that's a psychological thing I've been seeing as I've been getting back into the fitness and nutrition game that I left many, many years ago. But just from a fitness standpoint, people look to experts and personal trainers and be like, I want to start an exercise program. I'm very much overweight. I just don't know if this program's good for me. They're waiting for that person to give them the go ahead on that. And it's
Right.
like, dude, just go out and walk for 45 minutes. Like, you don't need to worry about the best program right now. You need to
Right.
move and start eating better.
You need to
Don't,
make
don't
positive.
wait for some authority to give you the permission to go out and be active. And that sounds like a lot with back pain. It's like they're looking for an authority to give them permission to feel bad. And
Right. So when somebody gives them permission to feel good
right.
or permission to move, if they're accepting to that,
Yeah.
then they get better really fast. So like a lot of people will come in and be like, I don't know what I could do. Two to three a week.
Yeah.
Two to three people a week. They'll come in and I'll say, well, what can you do? What can you focus on?
You've said that 100 times already in our first few episodes.
Yeah. And then once we can focus on that, on what they can do, they don't hang on these two things they can't.
Right. Right.
Okay.
And Fred Duncan talked about that in episode 12. That's such a key component, because we get stuck in that rut. And my role on this podcast is to be the tough love for the individual. But what you're saying is, okay, we know people have these mindsets coming in. It's on the healthcare provider to guide them into this right mindset, even if it is a physiological problem, to get them on the right path and how they're thinking about their treatment.
Right. And so I actually, I think it's, I think it's really actually fitting that you said that you're the tough love for the person. I'm the tough love for the healthcare providers.
Yeah. Yeah.
Like you're calling out you have, you have knowledge, you have educated yourself in the healthcare field. And that is what my life is, to kind of just branch off what Fred said, that's what I do all day. Right. I'm reading all day. My Twitter is blowing up all day with research coming at me so I can stay on top of the game.
Yeah. I look at the general population. I'm like, why are you doing a self-pity party? But I understand now that we have this platform, I need to be more sympathetic to the people we're trying to help, because shouting at them and be like, get your act together, is motivation to some people, but others got to hear like, hey, like what you're going through is normal. Everything and it's okay. Yeah. And everything you've heard from your professionals, don't get mad at them that they're wrong. It's just like, this has been an institutional thing that's compounded over the years. So we're taking our foot off the gas. We're taking a step back, and we're just saying, hey, there is another path over here. We think it will lead to better outcomes. It's not going to cure or fix anything, because I've learned that from you. We're not going to cure and fix. We're going to put you on the path to a better outcome. And if you accept that, the chances of you even just feeling better between your ears are astronomically better.
Yep. And giving permission. We talk about that a ton in our mentorship, is like when you give people permission to move, they, like a lot of people, and permission to focus on the positives and what they can do. And in the case of chronic low back pain, there's a huge shift in trying to restructure things right now to say, we need to make a shift from fix it to get you back to living your life. And that becomes background noise. Manage it, not manage it by like when you're dying, you're every month that you're laid up for 2 days. That's not managing it. That's in the
No.
forefront of your mind.
Yeah.
Manage it means you don't, manage it well means you don't think about it. Could it rear its face sometime? Sure. But you know what to do and you know how to handle it and you know what works. And if you don't, you could call somebody who can coach you through the right direction,
Right.
but not fix it for you.
Right.
And so this is, although it's low back pain, this is chronic pain.
Yeah.
Really chronic pain that is, we just keep searching for diagnoses and it's like, it's not there.
Don't even worry about our point. We'll get into the myths right now, but your point is don't worry about a diagnosis. Just worry about trying to feel better through doing some things. Like
Right.
It's that simple, right? So, all right. I think we beat the topic to death. Like you want to get into what those myths are that people hear, that you hear a lot as a provider as excuses for why people feel that way.
Yeah. So let's get into the myths. So, when I was like, even just like putting together, like what 5 myths am I going to present? Right. Like I have ones that I hear that I feel I talk to a lot. So that's what I'm going to present today. If you Google myths to back pain, the hits are, astronomical. There's a lot of people are talking it, but we're not practicing a lot of this stuff.
Solutions driven.
So it's not these are the top 5 myths ever. These are the ones I hear.
Okay. Yeah.
So myth 1, I just heard it yesterday, is that my low back pain is genetic. My mom has it. My dad has it.
Wow.
My brother has it. Everybody has it. Right. So,
like a history of heart disease.
History of heart disease, history of diabetes, history, is type 1 diabetes genetic? I don't. Do I know the answer to that? I don't know. But there's certain things that are genetic. Huntington's disease is genetic. It's your genes.
Yep.
There's very little change in it. There's certain things that are genetic.
Yep.
Your genes that make up your body are genetic. Like, yes, you have the same genes as your family. But what we also know is that we learn habits from one another. So I always use the example of like, how like you start looking and walking like your dog, like you guys kind of start looking like each other. Like that is something that is real because you're learning by the things that move around you. So if you're next to your family your entire life, you have their genes and you have their movement habits. And chances are you have their exercise habits and their eating habits and every other habits, good and bad, that they have, you have some form of those. So to blame genetics solely for back pain is tough.
Right.
Okay.
Yep.
So I just put a post up for us the other day. It was like same genes, same habits, same issues.
Right.
So one of those things you can change. You
right.
can change habits.
Right.
Right.
And for the record, but what you're saying is one, a myth for back pain is it is not genetic.
Correct.
Right. It's not at all. Like even because I worked in cardiac rehab for 3 years, heart disease and high blood pressure, stuff is hereditary, right? So that can be passed down. But even then, we still talked about there's things you can do to overcorrect that to minimize your genes, even though that's an overriding factor. Like at some point, maybe your DNA will take over, but there's still a series of things you can do. What we're saying here is your genes have no impact on low back pain diagnosis. It's more learned habits, and maybe that comes from your family and your environment, and most certainly does, but it's nothing to do with the DNA structure of you.
Correct. For the majority of, like, let's say major majority of low back pain. Yeah. And the other stat, and again, you approach this with people carefully because they really believe it. And you can't just say, oh no, it's not, you move on. But the other right. stat is, 85% of people will have low back pain in their life. So it's not genetic. It's a human thing. It's it's right. a how we're built. We went from 4 legs to 2 legs. Like it's a different, and so, those two things in general, that the fact that we learn habits and we like to move like those around us, as well as the fact that 85% of people have low back pain, to me just takes out the genetic component.
So that's a good first one.
Yeah. So if you have low back pain, I read something else today that was said, when people are hurting or have pain, they are more likely to listen to their family than their healthcare providers as well. So you playing bad cop to the individual, but and then I asked that, why is that from a healthcare provider standpoint? Is that because the information they're giving you sucks and it makes no sense? And you're coming in and saying, well, don't ever bend over again. Like, okay, good luck putting your shoes on. Like, or good luck taking care of your home or picking up your kids or playing sports, whatever it is you want to do. So I think that's, twofold there.
Yep.
But yeah.
All right. So that's a good first one, because there's not much to talk about from a solution. It's just like, just get that thought out of your head that it's you're not inheriting this. Therefore, it is something you can overcome.
Correct.
Okay.
Correct.
Perfect. Okay.
Yep. And that really is any musculoskeletal, majority of musculoskeletal thing. Bad knees, bad hips. Well,
yeah. My dad had that. Right. Yep.
Right.
Yep.
All right. So the next one is that myth number 2 is I need a specific diagnosis in order to treat my low back pain. This one is, it has layers to it. So if there is an acute injury, if you are a high school football player and you're catching a ball and somebody comes in and smashes you in the back and creates a fracture in your back, this is not what we're talking about here.
Right.
That one is an acute injury. Acute injury is another world.
Right.
That was an acute injury and it needs attention and it needs to be put in an environment that fosters healing. Right. So we're not talking about those.
Okay.
All right. Those are out.
Yep.
This is more the back pain that I've had on and off for the last 25 years. It rears its face. It goes away.
Yep.
I do something. It rears its face. It goes away. That back pain.
Yeah.
Right.
Yeah.
We're really hard, and the medical field does this too, is we try to put people in buckets and we try to say, because it makes sense, right? If you have strep throat, you get penicillin. If you have an ear infection, you get this. If you have this, you get that. So in medicine, that is the way for a lot of things, right? Although alternative ways, of course.
Right.
For everything, right?
Right.
But there's a path, right? You have this, you get that. You have a disc herniation, you do press ups. You have this, you do that, and just, that doesn't work.
Right.
So the move is to really, and it shouldn't be a movement, but it is to that it's a patient-centered approach. So you have to meet individuals. You have to consider pathology in your knowledge. You have to consider their values. You have to consider both of your experiences. There's actually a lot that says the treatment that you receive as an individual is dependent both upon your own beliefs and your clinician's beliefs. So if I don't live and breathe this, that we can really help people with chronic low back pain for the last 25 years, we won't. And there's clinicians who have had back pain for 25 years. So
right.
They're not treating individuals.
Yeah.
They maybe are treating them to the best of their knowledge, but they're like, oh yeah, I have back pain my entire life. Yeah, I get like that every 3 months and I just deal with it, move on or whatever.
Right. So is this a problem that is the mindset of the patient where like they'll push their doctors to be like, or they'll just be more receptive to test and imaging that they don't necessarily need?
Well, that I think, right. Okay. So we can include that. Yeah. Under this myth, like, so imaging, absolutely. So when you look at, like disc herniations, the research varies, but it's something like you can see research that shows that 40 to 70% of people that have that get imaged that don't have pain have a disc herniation. So if somebody comes in, I know we talked about this maybe in the nocebo episode, but if somebody comes in and says, I have a disc herniation on my MRI, but they don't respond to the disc herniation treatment, which again is clouded. Like that's not one thing. It's not like you have this, you do that. You have this, you do that. Yes, you maybe press up are kind of your first go-to, but that's so, for anybody listening to it, there's the McKenzie method that is considered with disc herniation, which, you know, is a method. It's not press ups. It's an evaluation and meeting this patient where they are. It just happens to be that press ups help 80% of people with a disc herniation. So we're like, oh, this is what, but it's, so people get lost, clinicians get lost even after going to those courses. So that becomes the problem, right? And that becomes the problem with an image, is that you don't treat to the image. You treat to the individual.
Right. But it's, and again, I was using imaging as an example, but it doesn't even have to be an image. It could be,
me saying it.
It just seems that there's a pause in developing a plan to help the person unless you say, this is why you hurt. And I think what you're saying is there doesn't need to be, this is why you're hurt. We just need to figure out how to move your body and what puts you in pain and what doesn't, and then develop a program, regardless if we know that diagnosis, which is a weird thing to say, because, right? And so I don't know what's that
population it is.
For the general, it's weird for me. It's weird for me to grasp my head around that. Like, you're telling me I don't need to know exactly what's wrong in order to develop a program. And you're saying that's correct.
Correct. So especially in a chronic scenario, especially in a scenario that didn't have a clear-cut start, stop, or an activity that started something to happen, right? So the environment of your body is up. Something's up. Could it be musculoskeletal? Yes. Could it be a kidney? Yeah. Could it be this? But that's where clinicians really need to hone in on, number one, the individual, take time with history taking, find safe entry points into movement, you know, really focus on the positives, that positive experience versus negative, what you can't do. Because most people will come in, I can't do this, I can't do that, I can't do that. I'm like, okay, what can you do? And then they're like, oh, well, everything else. I'm like, wow, you can do a lot of stuff. Like, let's go there, you know? So there's, you know, and there's actually, again, fitting, there was just recently a research article in the British Journal of Sports Medicine, again, that talks about how are we going to de-implement musculoskeletal labeling in these scenarios? Because we have people, I still do, and sometimes I think I talk too much and just try to talk them out of it, where, you know, if they say, could it be my QL doing this and that? I'm like, yes, it could be.
But it doesn't matter.
Treatment remains the same.
Right.
Could it be? Yes, it could be.
Right.
Yeah. What if I get an MRI and it shows a disc herniation? It's information, and we'll continue this treatment because it's making you better. Or we're going to change our path because you're not feeling better. So
it's a weird concept, because there's many problems, business, medical, nutrition. You do need to identify the problem. You do need to say, this is what's causing that you to feel that way. So therefore we can implement a solution. This goes against all of that traditional thinking of just problem solving.
Right. And in its own regard, it is problem solving and coming up with a relative solution of treat the person in front of you. Don't treat on a picture. You know, I can think back of pictures of me. I'm still the same person, but that picture looked wacky. Right. I was making a weird face. I was closing an eye. Like, you know, so it's just a picture of time. It's not the whole story, an X-ray or an image.
Right.
So when you say that, it's trying to become the norm, and clinicians, we do it too without images. You know, we say, oh, it looks like maybe you have a set issue, or you have spinal stenosis, or blah, 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 like all of these things versus, you got low back pain. I know what to do. We're going to just help you move, and we're going to help you feel better.
Right.
It's hard. It's hard.
Yeah.
And it takes a lot, and it takes a movement where we have to try to break away from labeling these things, because there is what we call catastrophization of things, right?
Yeah.
So people, if you tell somebody they have a disc herniation, go ahead and start reading about disc herniations on the internet. They got themselves signed up for surgery within 3 hours,
Right. Right.
you have to be cautious of saying, I might think the disc is, clinically think the disc is the issue.
Yep.
But if I tell them that, and then the next time they change how they look, and I'm like, oh shit, now they're responding this way. Well, it might not be a disc anymore. It might be this. Like, it just fucks up your brain. And we can't handle that. We don't know enough of that, and nor do the clinicians, because then we jump around and say, oh, well, if it's this, then we should do flexion. And if it's that, we should do extension. If it's this, we should do that. Versus just find what they can do and make them move.
Yeah.
And teach them to be positive, and teach them.
Yeah. So this is a good myth that outlined, because it is calling out the two constituents that we're here representing. Like, so from a consumer standpoint, don't worry about going in and getting an answer from your doctor of why your back pain hurts. Just get focused, push them. If you're a consumer, push them to just get you on a path of things your body can do that will allow you to overcome that pain, which is a series of trial and errors and evaluations of movement, not images, not testing, not results. And then from the provider standpoint, which you're pushing, is don't test everything. Like, don't test everything clinically. Just focus on the person, focus on what they can do pain-free, and then see how those things change over time.
Yeah. And pain-free is going to be wrong, right? Because, but yeah, I know, I'm sorry, I have to do it though. Pain-free isn't the expectation, and pain-free may, some people might, again, you're watching words, right? So some people, and this is what's hard on this platform, is some people may always have some pain. The purpose is to make that pain become such background noise that you are living your life to your fullest extent.
You can function. That you can function.
You can do whatever you want to do.
Right.
And if we can get people thinking along those lines versus fix it and get rid of it, it's different. If you understand that the hurt doesn't mean harm, and you understand that feeling it a little bit, there was a post on Twitter yesterday. It was fantastic. It was like, well, I stopped running and stopped going to work because my low back hurt. And then, patient, I stopped running and stopped running, just because my low back hurt. Clinician, how's your low back? Is it better? Patient, no. So why did you, does it, then there was some good conversation about being positive. So did running make your back actually feel better, or did it have no impact? Because if it makes it feel better, it has no impact, then why are you stopping?
Right.
Because somebody told you that it's compression on your discs and you have a disc herniation and it's going to make you worse.
Right.
No, so it's, and so when you say we're taught like this, and like to be solution based, moving to this type of diagnostic of saying it's just non-specific low back pain. There are so many factors to it. Here's what we do know. If we get you moving, if you have a positive experience with movement, if we build you up slowly into the things you need and want to be doing, you're going to do great. And here's the plotting, right? Yeah. Here's the plotting. So over time, you're going to start to feel better, but your pain might still be there. And eventually it will go down and your function will go up. And you plot it for somebody and you tell them what it looks like.
Yep.
So that they're not expecting to be pain-free tomorrow. And that is the miracle that people are promoting all the time. It's like, oh man, get rid of your low back pain with this. Like, that's not cool.
Right. And that only exacerbates the problem. And it gets people thinking that if they even feel that twinge, that they shouldn't be doing things when they probably could be doing the things they want to do, even though it's there. So the idea is to just do those things and not think about that. And like you said, background noise is a great way to put it. and I guess that's when, and I guess word choice is important. When I say pain free, I don't mean that you're free of pain, that you've experienced no discomfort. I mean pain free in terms of um,
Mind free, like you're not worried
mind
about it.
free, and in terms of free to do whatever it is that you need to do in your life, and that you're not letting the pain control you. You're free
Yeah.
of pain. You're free of the pain, not free of pain. You're free of the pain, to free
Yes.
to do what you need to do.
Yes.
Um, okay. So yeah, so those are two good myths. So I mean, the first one is so easy to understand. It's just not passed down from your family. This one is a tougher one to grasp, I think, for a lot of people, including clinicians. So
Yeah.
yeah,
Oh yeah.
but you don't need to know what exactly is going on. You actually just need to work backwards. You need to just start with movement
Yeah.
and see how the body responds, because the image or the test or the diagnosis that you would get from those has no impact on what you would try with that patient anyway.
Correct.
Wow. Yeah. Okay.
Yep. Yeah. Very, very correct. It doesn't change, and people were resilient, and I
Yeah.
think that's another thing for anybody listening is you question what changes when I do X.
Right.
If you go running and every time you run your back hurts after and you can't sleep and it hurts tomorrow,
Yep.
that's not what we want right now. We need to find your entry point, and right now you're blasting through that.
Yep.
So, can you walk? Yeah, I can walk all day. Cool.
Right.
Can you bike? Yeah, yeah, biking doesn't feel fine. Awesome.
Right.
So keep your physical activity guidelines up, right? Keep your
Yeah.
30 minutes of work every day and move as
Yeah.
much as you possibly can in a day. But to get to that, then we break down the components of that based
Yeah.
on movement to say, what do you need to run? Okay, we
Right.
need, and again, this is in my head versus like nitpicky telling everybody things.
Right.
But I definitely know we've succeeded with treatment, the patient and myself, when that patient comes in and starts talking about function versus pain,
Yep.
and then says, yeah, I feel it, but it doesn't bother me, or if I do, yeah, sometimes I do that and I just have to do this. And once I hear that they can manage themselves,
Yep.
that is the best feeling that I can have
Very
ever.
cool. All right. So, all
Okay.
right, myth number 2, you don't need to know that specific thing that's quote unquote wrong with you.
Correct.
All right.
All right. So myth 3 I put down is rest is best.
Kind of ties into the last one.
Kind of ties into the last one, so we don't have to hammer all of that. There's rare situations where rest is what's needed. Again, let's take out acute injuries. You fracture your back, you can't be
Yeah.
moving around, right?
This is an interesting one because, uh, again, I'm one of the 85%. I had a period in there where I would tweak my back a lot, playing basketball, just in a defensive position, and I'd tweak one way, and then my lower back would get swollen, and I would be walking kind of funny. And the only thing that felt better was me laying on the ground and putting my feet up elevated, kind of perpendicular to the floor. And it did make me feel better, but I'd have to do it for 2-3 days, and I didn't, and eventually that stuff went away. But I'm even wondering if I could have recovered faster if I was trying some stuff more on my own.
Yeah.
And I'm
And,
sure
and
that's the
so
case for a lot of people,
yeah, I mean, we could take you through that. I mean, rest is best. I mean, in my head means you're doing absolutely nothing. Rest in the beginning could potentially, the beginning phases of a rehab program might be laying on your belly and breathing to calm your body down.
Hmm.
But it's an active approach versus a passive approach.
Yeah.
I have somebody that I've treated years ago that was, anytime she hurt her back, she had somebody she knew that was a surgeon, and he
Right.
would be like, "Don't you lay on your back and don't move for 4 days." Honest to God,
Yeah.
and he would
Right.
lay there, and I'm like, oh my God, like so.
Yeah.
So not only are you associating now psychologically, you're associating if you have this back pain, I can't move for 4 days, or I'm going to make it so much worse.
Hmm.
Like that is a tough onion to peel. Like you got to
Yeah.
peel back so many layers on that.
Yeah.
So yeah, but could you have recovered better? I don't know. And you know what? And here's the thing is we're freaking resilient. So we recover, we heal,
Right.
things heal on their own.
Right.
We question all the time is it what we did in PT or is it just the patient got better? You don't really know. But what
Yeah.
I do know is how I made them feel. And what I do know is how I helped them promote getting back to sprinting. I know that.
Mm-hmm.
And would they have done that anyway? Maybe, maybe not. I don't know.
Right.
But that's where the patient working together with the clinician is super important.
Yeah. So rest is best is a myth, but rest is certainly a component of it, right? Like I think where you're going is the extreme, like do nothing, lay on the floor, don't move at all, don't do anything, and that's how you get better. When we're talking, and especially when we're talking with chronic stuff that keeps coming back, what is, and I don't want to use best, but like what is a more sound logical approach to that? It's incorporating some rest with what, testing and experimenting how your body can move and what functions you can do.
Absolutely. So when I say that the rest thing, you might have to rest from an activity that is increasing that pain.
Right.
So that's where, like, again, running, like, okay, or basketball for you. If every time you played basketball, your back felt like that and you were laid up for 2 to 3 days, one time is one thing.
Yeah.
One time is one thing. Things happen. You
Right.
got over it, you're resilient, you moved, you got back into activities. But if that's happening all the time, or you take a month off, then you go play and you play for a week and you're fine, and then the next week it happens again, something's up with that. So is it that we say don't play basketball? Maybe, it depends. I kind of, I know we've utilized like the traffic light analogy that was introduced to me is like, 0 to 3 out of discomfort that stops when you stop. There's really nothing to worry about. If it's getting into 4, 5, 6, the yellow light, I don't know. It depends on tissue irritability. It depends on some other things. Red light is above that where it's just not a positive experience for your brain. So why keep doing it?
Right.
Because it's going to want to alter you and change you.
Right.
So rest from certain things or modifications is one thing.
Right.
Laying around or being told not to do anything makes you so fearful of moving in pain that if you, like that one woman I said, if you keep going like this, it's going to slice your spinal cord. Like, no, it's not. Like, it's not, there's nothing to even say that. Like, no, so like, or like whether that's what somebody said to this woman or whether that's just what she heard, that's the perception she had. So why move if I'm going to ruin something and be in worse pain? Where, then you decondition. Now you don't move. Now you don't do this, right? And now our cycle begins. Now our cardiac and diabetes and cancer stuff risk goes higher because people stop moving, because low back pain really does drive people to be scared of moving because it can be so damn intense.
Right.
So intense.
Yeah.
And
so there's a conflation of rest, meaning do nothing, versus a rest of, well, maybe you're going to take a rest and a break from a certain activity, but doing other things at a lighter scale or different series of movements that aren't the activity that caused the pain will allow you to get back a little quicker, or allow your body to respond in a manner that will get you back to what you want to be doing faster, versus literally doing nothing. So when I think when you're saying rest, you're saying literally doing nothing. It could mean taking a rest from that activity, but it's not doing nothing in to supplement that. It's finding other stuff to do that will get you back to there.
Correct. And in the end, and same,
so that's and I'm sorry, and that's a red flag then, right? If somebody's telling you do absolutely nothing, you might.
I need to know why. So like let's use an ankle sprain, or let's use an ankle fracture. Like, so if you fracture your ankle and you're in a cast, like, why can't you do arms? Why can't you do modified planks where your foot's not on the ground? Why can't you do, and maybe it hurts like a son of a gun for a few days, so you don't really want to because you're exhausted and you're, there, I get it. But then when you start to feel like, okay, this is managed, like, you can do stuff in kneeling to build up your hips. You can do trunk stuff and core stuff and arm stuff, so that when you come out of that cast,
Yeah.
now you're not dealing with this whole issue, you're dealing with the local spot. So
Right.
exactly. So, but in the presence of chronic issues,
Mm-hmm.
not moving doesn't really change people's pain levels, but they're fearful to move because it hurts. So finding an entry point, finding somebody, anybody,
Yeah.
a PT, a personal trainer, a
Yep.
chiropractor, anybody who will help introduce you to movements that are positive and get you going is crucial.
Very cool.
Okay?
Yep.
All right. Myth number 4, I need someone to fix me. This is a big one.
We've talked about it in different capacities in prior
Yeah.
episodes. Yeah.
Yeah, this is a big one. And, I just don't think the human body is portrayed as well as it should be, that it's a resilient healer on its own. And the normal course of things, again, I know I mentioned this once, but we don't know if what we do works, because time heals things. But we don't also want people to be fearful of movement, which is where I find my seed better. Not that I'm healing them, but I'm helping them manage how to get through their process with them. There's really, and that's the tough part with low back pain, like no one approach is the best. If somebody responds to a manipulation, like a chiropractic, PTs do it, or even soft tissue, like massage or stuff like that, that's fine, but then it shouldn't keep coming back. Right. So like I'm not opposed to things per se.
Right.
I would say more than ever, like I don't put my hands on somebody
Yeah.
for multiple sessions, and
Yeah.
sometimes never, because if
People.
they do it themselves, I'd want them to be empowered versus feel like a victim that needs me to solve it.
Yeah. People get frustrated with this one on my end, the consumer standpoint, because they're like, what am I going to you for? You're just telling me things to do. And once I know those things, I can just do them on my own. And you're like, well, yeah, well, number one, yeah.
Right.
But two, me manipulating your body and putting you through range of motion exercises or putting you in certain positions isn't going to put you on the optimal path to solve it anyway. Like some of it may be beneficial, some of it may be necessary, but it's not the core foundation of what's going to get you feeling that way. So like,
Right.
what's that response to a patient? Or like, okay, now that you taught me these exercises, I can just do these at home. I don't need to come back to you.
Yeah.
Where
So I'm hoping I'm getting that on the forefront, right? So like, again, if we're in this together as a patient and a clinician, and it's a patient-centered focus, and we use that analogy of being Alfred versus Batman. You're Batman, you're the shining star, and I'm just here.
the
And I'm just
patient
gonna
is the
help you.
shining star. Yeah.
Correct. So that is from day one, just the relationship you build with somebody.
Yeah.
And in traditional settings, I'll pick on PT, traditional PT settings, people get like that because they go in and they're like, okay, go ahead and go through your exercises. And that's their session that they're paying for.
Yeah.
There's not assessment. There's not thought. There's not, oh, how is your body responding? How are things going? It's just, oh, you're a rotator cuff repair. Here's your exercises. Check mark them as you go through.
That answers my question, because passive treatment and where you're manipulating somebody's body and you're making them do things, that's one thing. But it's not passive if you're there having a conversation with you. You know what I mean? Like if you're there and then you're evaluating, how does that feel? Like how is your body responding? Do you feel fatigued later on the next day or at night after you do this stuff? That conversation is not passive. So in a traditional healthcare setting that we've talked about, where you come in for PT, you're in there with 5 to 10 other patients. And that PT is like, okay, here's your list of stuff to do, go do it. And they don't watch you, or they only make it around to you like every fifth exercise. They talk to you for 30 seconds. How you feeling? Good? Okay, cool. I'm going to go talk to Joe now and see how he's feeling. There's no feedback there to know if something's working. So in a cash-based setting where you're really customizing the care, you're there one-on-one with them, and you're getting feedback from them, even though they're doing everything on their own. And you're more able to customize or tweak or audible at the line of scrimmage, like a quarterback be like, okay, or you're progressing much further than I thought. We can
Yeah,
try some other stuff.
totally.
Where
Progressive low back.
if they were in a traditional PT, they would probably just be going along at these increments and maybe not pushing themselves as far as they needed to push to get to a better outcome quicker. So
Yeah.
that's a big distinction in passive treatment, where even though you're making them do the exercises and they're doing it on their own and they could do them at home, the feedback loop and the information you are good at interpreting. Okay, based on what you're saying, we can try some other things or tweak your program.
Yeah, and I think that it's funny how you read passive care. Passive care to me is like massage. I'm using my hands.
Well, that's what I meant. I'm almost redefining passive,
Yeah, yeah. So passive care and or like unattentive care to some degree. So
Yes.
there are I do think there are offices that do a fair job, fair to with the model they're in, where you're trying to give everybody what they can. But I totally agree. Like when I'm with somebody, not only because of that of feedback I'm giving them, I'm also like able to relate it to how it's going to help them with their goals. So,
Right.
oh yeah, sweet. That's awesome. That is what a foundational movement for going downstairs. Awesome. And I'm
Right.
always reiterating that. And they're always hearing that. And they're always working towards their goals with every move they make. Right.
Yep.
So that is that, when people, there are exercises, like if you have Achilles tendinopathy, you have to load it. Like you have to load it. And there's certain ways to load it that you need to do every single day.
Yeah.
You're not going to do those with me. That's a waste of your time. You go do those and
Yep.
we'll go work on the other things. I'll check them. Let's
Yep.
ask questions.
Yeah.
Let's make sure they're doing what they're doing.
Yeah.
Let's make sure in exercises, the target tissue you hit is working. Like I can't tell you how many people come in and do like in the gym are doing like an ab hollow exercise. And I go to like show them or talk about it. And they're like, oh yeah, I never feel these in my abs. And I'm like, okay, so where are you feeling? I'm like, my hip flexors or my back. And I'm like, okay. So then I back it down 3 levels and they're like, oh my God, my abs are killing me. Like, perfect, great. This is where you want to be. So that individualized, finding each individual is what we call floor, where they can move up from there is crucial.
Yep.
And you have to get feedback from them.
Right.
You have to know, you don't have to overanalyze, but you're chit chatting like we are. And you're like, oh, what do you feel? Oh my God, my glutes are killing me. Great. Keep going.
Yeah.
Oh, I don't know. I feel my groin. Oh, cool. Turn this.
Yeah. And that's my point. The passive care, people are like, if I'm not getting passive care in terms of I'm not getting massage and I'm not getting put through and they're just telling me what to do, that becomes frustrating to them because they're not getting in traditional healthcare, which is a problem we're calling out. They're not getting that care that you just talked about with them.
Right. Totally.
All right. So anything else on that one? I need somebody to fix me. The answer is no, you need somebody to teach you and then you'll fix yourself, and fix is even the wrong word, right?
But yeah, I don't mind an individual fixing themselves. Cool. Fix yourself. That's great.
You're going to fix your habits. You're going to fix your mindset. You're going to
improve your this, improve that. And I like improve because fix is like a hard stop. I did it or I didn't. Right.
And it's never a problem again. Right.
Chocolate. Like if I say no chocolate, it's worse. If I, if you say fix versus let's get on the path together, here's your roadmap. There might be little ways to go.
Yep.
Let me help you along the way. And if you take a wrong exit, call me and I'll get you back on the road. And more likely than not, that is not going to be manual work from me.
Yes.
Not that you're going to rely on me. You're going to rely on me to help coach you on your direction.
Yep.
You're not coming to me for manipulation. You might, and that visit might be reassurance. Nope, you're doing great. Keep going. This is normal. Look at, this is the path. Remember we talked about this? You might have that and that. Oh yeah, I remember that. So guess what? I'm not going to change anything about what you're doing. I think you're doing fabulous.
Yep. And and that's a good level set. So
yeah.
Okay, cool. So that I like that myth. Yeah. Nobody's going to, number one, nothing's going to be ever fixed. It's going to be, do you have the best chance? Are you on the optimal way to feeling the best self that you can do everything you want to do? It's a longer sentence. It's not as sexy as saying it's fixed. You know what I mean?
Yeah. Okay. And I like managed, but I also don't, because it kind of means that you're living with it all the time, which still is the way.
Yeah.
But you're like, I've changed my ways. I've changed my, all right. So we've had discussion on this, and you've been with, we were siblings. So you've known me long enough that we've talked these things.
Yes.
So myth 5 is my poor posture is causing my pain. And you and I have talked about this even recently.
Yeah.
So if you were to come with me 8 years ago, I would be very ergonomical, very like, oh, how are you sitting? What's your position? Can
Yep.
you sit up straighter? Can you pull yourself back? Can you do this? Can you do that?
Yeah.
The last probably 3 or 4 years, I've really gotten away from that um, because number one, it's too much attention.
Yep.
It's too much attention.
Yep.
All right. So yeah, but now, in my practice now, I almost never talk about posture.
Yeah.
There's many reasons. One is it's just too consuming for our brain. If you're sitting here having to think about where every part of your body is throughout the day,
Yeah.
it's such a burn of energy, right?
Yeah.
If we're talking about like, oh, squeeze your glutes, and every time you run, your glute should be on when you're extending your hip, and when you're running, you're not going glute, 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 like
Right.
and same with posture. Like, if you're looking down at your phone, okay, there's science to say it's increased pressure on your neck. There is, and I don't disagree with that.
Mm-hmm.
So, could you modify things? Like, could you be aware and say, like, okay, instead of looking down like this, maybe you're like this instead of down all the way? Sure. You
Yeah.
can have healthy thoughts with it, but to be like, okay, shoulders back, ribs down, do this, do
Yeah.
that all day
Yeah.
long
Yeah.
is just not cool and not how we're made.
Right.
Um, so I think I've been using the example, like the statue of like the thinker.
Sure.
He was pre-cell phone. His posture sucked in that position.
Right.
Right?
Yeah.
There's a lot of hot buttons here. Like you could look at Michael Phelps' posture; it sucks. He's very rounded. His posture sucks.
Yeah.
The most winning
Heads
Olympic.
forward. Right. Yeah. Yeah.
Terrible posture,
Right.
right? Based on how we define it.
Based on how we define it. Right.
Correct. And then so another one is oh God, Michael Johnson, sprinter.
Yeah.
Olympics.
Yeah.
If you look at him, like his pelvis is so far tipped anteriorly that 8 years ago, I would have been like, oh, we need to correct that. And it's like, well, do you? Like, no, you don't. So posture, it's come a long way. I think it's demonized a little bit. And I think it's demonized more because we're not getting to the root cause of what are the opposite muscles that we aren't working during a day. So if you sit all day, even if you run 10 miles in the morning, and then you sit all day like this, I always say like your yin and your yang is off. Like, you just haven't gone this way all day.
Right.
And we
Right.
like balance. Our body likes to
Right.
move and all of that. So
Yeah,
it's not necessarily the posture, it's the lack of movement in other ways that then makes that posture painful.
Right. Right. Yeah. The yin and yang is a good way. Like in theory, you could sit all day for 10 hours if you did a series of activities in the hours that you weren't sitting like that, that would balance out anything detrimental that comes from sitting like that for 10 hours or 8 hours or whatever.
Yeah. So in the workforce, there is some research to state like if you do like certain exercises, like certain nerve glides and stuff like that throughout a workday, like in an hour,
Yeah.
that if people have been educated on that and it fosters an environment in which the employees will do it in a day, then they don't hurt from sitting all day, or their prevalence of low back pain is so much lower just because they did like 5 or 6 movements throughout the day to unwind a little bit.
Yeah. And that's a on top of that, it's probably key to say, as opposed to saying don't sit like that, and because then people start thinking about it, it's just saying, hey, if you're sitting throughout the day, do these 2 to 3 things 4 to 5 times a day, once an hour, whatever it is. Just if you do those 4 things, then really what we're saying is you can sit however you want. Yep. Because you're going to balance out. So you won't make people think about the time they're spending doing something naturally, which might be sitting in a certain position.
Right. And I'm not against ergonomics. Like,
of course,
right? Like, I am not against ergonomics, but I'm against it as the fix.
Yeah.
right? Like
Yeah.
the overriding theme is that we don't move enough and we don't program well enough
Right.
for people to live their lives.
Even if I'm sitting in the proper position with what quote unquote proper, if I'm sitting in an optimal position with, kind of up straight, shoulders back, head kind of forward, not neck down, even just sitting like that for 8 hours is not great for the body. And you would need to balance it out with certain activities, especially I'm thinking hip flexors and stuff like that. You still need to do certain things to assure that your body doesn't get hurt down the road, and that a certain muscle groups that are ignored when you're sitting like that are active enough that can support you when you go back to just sitting like that.
Correct. Like yes, right? Like so we could sit here and say, yes, sitting increases tension in your hip flexors. It's a meat tenderizer to your glutes, right? It aerates them, it smushes them, it turns them off, right? You have a trigger point, you push on it. You push on your glutes all day long, they turn off. Yes, I don't disagree with all of those things.
Right.
So I always tell people a few things. One is standing. So people are like all into a standing desk now, right? Like standing, smoking or sitting is the new smoking is kind of a tagline and all of that, which again, I don't disagree. But I always say that, standing, and people are like, well, what about a stand-up desk? Isn't that? I'm like, okay, standing is better than sitting, movement's better than standing.
Yep.
Period.
Yep.
And if you, think about, have you, and we talk about like earn the right, right? Earn the right to sit how you want.
Sure.
If your back muscles are strong, you're not going to think about posture because you're going to already be upright. You're not going to have to think about being upright. Your muscles are going to hold you. If you're sitting like this for 4 hours, you're going to get tired and you're going to slump. So if you are stronger, do you remember going to, I think it was the Elite Eight game in Syracuse, and we were having a posture discussion, and Ashley Judd was there because Kentucky was playing. Do you remember this conversation? Sure. So it was me, you, Aaron, Mom, Dad. I don't think Jen was there. So but the 5 of us are sitting up away from the court a little bit, and we're talking about posture, and we're talking about looking, and all of a sudden we spot Ashley Judd, and she's sitting like pin straight, right? Like her, I don't know if I could see her. She had a white shirt on. Her hair was half up, half down. I can see her.
Yep.
And she's like, like watching the game intently because she's a huge fan, right? Just going back and forth. And I'm like, she is not thinking about her posture. Her posture is like that because she works on her body. And then we look at everybody else sitting in the bleachers like this, right? And I'm like, she's not trying to do that. That's just what she has earned, like by her work on herself. Right. So like, to me, that was probably around the same time that I started shifting my thinking about posture. So.
Yeah. I mean, yeah. And and I guess it's just a stupid thing, but I've like always kind of prided myself on my posture. And it's just like, it's a stupid goal to have, because in my mind, I'm focusing on how I'm sitting right now, but I'm not thinking about that I am sitting correctly because I'm doing things correctly when I'm not sitting.
Right.
And
posture's a goal for a lot of people. Posture is like, people are like, I don't want to be bent forward. I don't want to be leaning, like, and so
people that have quote unquote bad posture might feel fine though, right? Like,
yeah, I would say some people are self-conscious about it. Right. Some people are self-conscious about it. I do see, or feel, I guess it's more of an opinion, that like an upright posture is much more of like a power position. Like you just, right. Like if you watch a presenter who is, their posture is solid and they just look good, right? Like people look good with some form of variant within a normal posture. If we're leaned over and our head's really far forward and we have a big hump in our back, people are self-conscious about that. People get self-conscious about a bump like in the back of their spine. They're like, I don't like this. I want it to go away.
But the myth here is that my posture is causing my pain. And that's not the case. It's my activities are causing my posture. My lack of activities or lack of training certain muscle groups are causing my pain. That may be associated and correlated with how my posture physically looks.
Yep.
But one is not indicative of the other.
Yep. And so yes, those conversations are still had. If somebody's neck hurts when they're looking down, and we're starting to work on opening them up and getting them stronger and getting their posterior chain to engage, will I tell them to move their computer screen up in a work day? Yes. Sure. Yes,
Right.
that stopped the bleed. That's rest.
Right.
Rest those
Right.
structures, change the environment.
Right.
But in the meantime, you have to be working on the underlying cause. It's not the computer screen that did that.
Right. Right.
You weren't ready for whatever, so it's
Yeah.
no
Yeah.
looking down at a laptop for 4 hours that you haven't done forever is no different than going to run 2 miles. Your body is in a position that it's not ready for
Mm-hmm.
and it can't tolerate. And
Got
then
it.
something will hurt.
Yep.
So yeah, so I really do think the posture conversation is just overdone.
Love it. Love it.
Overdone.
So, all right. I think those are 5 good starting points. I think people will probably now respond, well, then what should I do with my back pain? And we've touched on it a little bit here, but the whole point is you should be working, I don't know, not consciously, but you should be actively working um, to work through your pain, right? Like, and again, I don't want to say work through your pain, but you should be working through your pain in terms of you should be doing activities. You shouldn't just be resting. And it's not one thing that's causing it. It's probably stuff that you're not doing that's causing pain. And that the solution to it is not a therapy or a surgery or a pill or rest, but it's a series, it's those things coupled with actually doing activity where the body movement, we're focused on moving. That's the overarching theme through all of these is there's not one thing and it's not why. And by the way, stop worrying about why. Just focus on working on a solution.
Right. Yeah, and it's again, like to a patient. So like if I have somebody that calls me a family member or something like that, it's a very hard conversation because it's not a fix, and more so it's trying to bring their guard down, trying to take their fear down.
Yeah.
So that's where, like you gave like Howard Stern as an example, where he went to, if this doc was an orthopedic, thank God he had the training he did, because he could have been cut and opened and moved, and all because his life was just a little bit in shambles or a lot in shambles. And,
Yeah.
getting through that, you have to have a coach or a clinician or somebody that helps you to guide you.
Yep.
You can do it yourself, but if you're finding
Yep.
dead ends, sometimes again, just finding somebody who will say it's okay. Like that's
Yeah.
where I often say, personal trainers have an advantage because their number one goal is get people moving. And if they just get them moving and do it in a safe place, in a safe way, like a safe entry point that challenges somebody, but feels like working out, but doesn't aggravate something really significantly,
Yep.
they do a better job. Or maybe they just sit and talk with the patient and try to get down like what their fears are. But so, if you're struggling with back pain, looking for providers who aren't looking to solely say, what can I do for you? That are saying, here's what we're in this together. To me,
Yeah.
those words from a clinician
Yeah.
are huge. We're in this together.
Yep.
I want to help you. I have many tools I can use to help you. This is what I need from you. This is what I see. Let's get you going and go from there. Because even if there is a significant psychological component, somebody just listening to you and including you in the care
Yeah.
can be a big part of your outcome.
Love it. Okay. Really good stuff. And again, I think down the road, we're not stopping this podcast anytime soon. So, we might cover types of movements to do throughout the day as preventative measures, right? That can help people with back pain, people that sit all day, even or stand and sit but aren't active. The types, one, go back and check out our physical activity guidelines to see how much you should be moving. 2, look at our episodes 10 and 11. We break down the primal movements, the types of movements you should be doing. That will probably cover a lot of preventative stuff, just doing those ABCs and getting back to those fundamentals. But I'm sure we can come up with some specific stuff that is targeted around these types of movements incorporated in those guidelines and those fundamentals will ensure that one, you avoid back pain at an optimal percentage, and 2, if you're having back pain, that these are the type of activities that fall into those guidelines that we already discussed, that here's specific things and programs that can alleviate, get you on the right path, shift your mindset, and that will be good for you and that you can work through, right?
Yep. And yeah, I think, getting somebody on the right path is the biggest thing.
All right.
And
Very
just
cool.
everything about that. Yep.
All right. So thanks for joining us, everyone. This has been the back pain myth episode of the Body Movement. As always, hit like and subscribe down below, and we'll see you on the next episode. Thanks for joining us.